record the
This meeting is being recorded.
Yes. So I
Yeah,
can
yeah,
yeah.
great. Yeah.
We're going to hand over first. Yeah, we're going to, this is about the MRCP exam. This meeting organized by IMA, UK and Europe. And we have 2 senior speakers and 2 junior speakers. Our very first senior speaker is a Prof. Jawad. He's a senior consultant physician. He's a senior examiner in the college. He used to design a question for PACE 1 and PACE 2. He's hoping today to share a few ideas for you to help you how to pass this tricky exam. So, Prof. Jawad, the platform for you, you can talk about your slides.
Okay, I go back again to the previous slide. As I said, this examination is a different examination from the old exams of MRCP some years ago. It mainly focuses on skills, testing skills, and the skills are only 7. These skills, which I will come to later on, they cover physical examination, finding, management, dealing with patient consent, communication, and so forth. There are 7 skills, and you need to achieve at least 70% to pass each skill, to definitely pass it. If you achieve half or 50% of the required mark in one skill and you get to the top mark of the rest of the skills, you still fail, unfortunately. And I've seen that with a few candidates. Knowledge is very important. Clinical findings are very important, but you need to know how to apply them in a real life scenario. Now, so the exam covers multiple elements of the performance. It covers most of the essential systems, unlike the old exams where they used to test you on a couple of systems like chest and abdomen, and they don't test you on the rest because of the time restriction. So it is a less subjective, more fair exam, and they expect you to perform as an experienced IMT, IMT level, not a registrar, not SPR, with indirect supervision. So they don't expect you to behave as a consultant at that level of the exam. So therefore, the exam, because it is costly, it is time consuming, you need to be prepared. Prepare for the exam, you need to have an average experience of in every system, like neurology, cardiology, abdomen, chest. So if you don't have, for example, experience with chest medicine or cardiology, you should not sit the exam. Wait until you get some experience and you learn, because the questions are usually they test your practice as well. If you have dyslexia, mild dyslexia, you need to benefit from that. Provide a formal letter to the roll call of physicians. They give you, we offer you as an examiner 20 minutes before the exam. You can read all the scenarios, carrying these scenarios, from a station to another with you. So that is a great benefit, of course, for somebody with dyslexia. If you are used to a digital stethoscope, of course, digital stethoscope might cause a bit of problem. It is too sensitive. So it might be too sensitive, it will, although you can hear the murmurs and abnormal sounds better, but you can, it can cause a bit of problem. But we still accept digital stethoscope to be used in the exam. Also, you might see different examiners with different behavior. Somebody who's loud, somebody who's quiet. So don't worry about that. Don't get distracted. Focus on the questions and try to deal with them to your best. So avoid distraction by the examiner or patient. Focus on the question and get on with the exam. If you don't do well in a station, just put that performance behind your back. Try to benefit from experience and move on to the other station. Because if you carry over your worry with you from station to another, you will definitely fail. So try to avoid that. in every station, of course, you are expected to introduce yourself and ask patient about their name and address them with the question you have in the scenario. In terms of dress, you should not wear casual. You need to be a bit formal in your dress, not to wear tight, tight clothes or transparent, which is not that decent, and especially not to wear dark glasses or ladies having facial veil on their face, يعني too much hijab, because this will preclude any skills of communication which might be misjudged by the examiners. Other points to consider, very important, you can pass in all the stations perfect, but you cause, for example, the patient or the surrogate physical or emotional distress, or you draft a plan which is to some extent fatal, or jeopardizes the risk of the life of the patient. In that case, the examiners they have the discretion to fail you, despite passing all the stations. This is called skill G. We'll come to it. Okay, so one thing important, in your time, you need to cover all part of the examination, which I will come to it later on. If you don't cover certain skill you perform, or you don't cover certain part of the examination, for example, you don't have time to do auscultation, we will fail you. The examiner will give you 0, even if you are very good in answering the question and making the diagnosis. So you have to be aware of the time to cover all the skills and all the the steps of the examination.
Dr. Suliman, Dr. Suliman, sorry to interrupt. I have been told that there is only 5 minutes to this Zoom meeting. So I put on the chat another login, please. Whoever is with us at the moment, if you can copy that, and in 5 minutes, re-enter this ID meeting number and the passcode, please. It is on the chat. So we can log in back in 5 minutes, because this meeting is going to be interrupted in 5 minutes.
Okay.
Yeah,
so shall we all do that?
No, you carry on, Paul. You carry on. Yeah, carry on until we stop. Carry on.
I carry on until I stop, then I log in again?
Hey, because we still have time. We still have time. Carry on.
Okay. So, yeah. Candidate, as a candidate, you need to be aware of time. You need, during the examination, you need to mention relevant negative signs when you clinically examine a patient. It is as important as the positive signs. And try not to make up signs, which is very bad. You'll doom yourself to failure. And you can say, I'm not sure, I don't know, things like that. You need to be honest in the examination. It's basic things. You need to make sure you write your examination number correctly, and clearly. Otherwise, you may miss the opportunity, of being marked correctly. You might come across one examiner in the station, not 2 examiners, because of shortage of the examiners. So they will tell you at the beginning of the examination of that, and they will give you the chance to withdraw from the examination, or you continue the examination. But most of the candidates, they continue because one examiner can double mark you. And you might see one examiner developed an emergency, for example, or he becomes annual, so they end up with one examiner. So don't get distracted. Carry on and move on with the examination. And you are not allowed to appeal against the marking of the examiners. Examiners, مثل حكم المباراة. If they give their decision, that's it. But you are allowed to appeal against organizational problems. For example, a machinery drill next to the exam room, which clouded your thinking, or a plane noise which disturbed your communication, or somebody's mobile went on, or there is a fire alarm which can happen. A fire alarm, in this case, the examiners, they take the candidate or the surrogate on one hand, they separate them from the patient, and another examiner takes the patient to other side, and they stop the examination at that point of time. Then when they take you back to the station, and then add the rest of the time in that station. They don't go back from the beginning. Common things I want to mention, for example, in respiratory medicine. Respiratory medicine, of course, I'm not telling you how to do the examination. Examination is straightforward, really. You need to make sure that you do all the steps, like an inspection, percussion, auscultation, and you need to examine both sides, the front of the chest and back of the chest. And as I said, you need to mention negative relevant sides, like, for example, no finger clubbing, no central cyanosis. Usually they bring to the examination chronic cases to the examination. Otherwise, difficult to, to present a patient or surrogate with signs. So, for example, a well-known interstitial lung disease, patient with basal crackles. So you need to check and make sure, is it these crackles, are they changing with cough, not changing with cough? If they're not changing, they point towards fibrosis, more likely, and also talk about differential diagnosis. The priority diagnosis first, and then differential diagnosis of other possibilities. For example, interstitial lung disease, it could be bronchiectasis, could be a congestive cardiac failure, and so forth. And when they ask you about management, which is important, because you have only a few minutes. I'll come back to how many minutes you have. In fact, you have only 4 minutes. They ask you about the finding and the examination. Don't forget to mention the oxygen requirements, if there's a respiratory rehabilitation required. Abdominal examination, again, they bring you chronic cases usually. And in the UK, even outside UK, I'm sure, chronic liver disease is one of the most common cases.